Ebola quietly appeared in late 2013 in a remote corner of West Africa. Though Ebola had appeared many times in other parts of Africa, this outbreak would be like no other, even reaching the United States and Europe. By mid-2014, Guinea, Sierra Leone, and Liberia were in the throes of a swiftly escalating regional crisis. Ebola's threat suddenly became starkly real for Americans when the missionary doctor, Kent Brantley, and a colleague arrived in Atlanta, the first Ebola patients to reach American shores. Another first soon followed. As the Ebola crisis worsened, President Obama ordered troops to West Africa, the first ever U.S. military deployment to battle a dangerous disease overseas. Fear skyrocketed when Thomas Eric Duncan, a Liberian, sparked a crisis in Dallas. Duncan became sick and died of Ebola while infecting 2 nurses. And as the fall of 2014 unfolded, Ebola turned America upside down. There were a mere 10 cases of Ebola in America in 2014, including 2 deaths and 2 secondary infections. There was a media storm, calls for quarantines and travel bans, stigma against health workers and their families, and widespread confusion. Clashes broke out over who was in charge and how best to protect Americans. This CSIS documentary examines how Ebola was experienced in America in the fall of 2014. We've drawn upon extensive work at CSIS. We've reached out to many individuals who played key roles in Washington, Dallas, Atlanta, New Jersey, and elsewhere. This is their story. We're grateful to each for their courage and leadership and for sharing with us their reflections on this extraordinary, turbulent period. Several factors drove Americans' fear and panic. Most fundamental, Ebola is a rare, highly lethal disease.
Ebola is a terrifying experience. It's terrifying and humiliating. It's painful. It causes severe headaches, body pain. It is scary to see the symptoms that you've seen in patients developing in your own body. And even those people who come to help you can't touch you. And that was one of the hardest parts of it, was the anxiety that loneliness caused.
It's also terrifying to Americans because Americans were watching these horrifying images coming from West Africa, but never expected that it was going to land on their shores. And Americans simply did not understand the basic science, that it was transmitted by exposure to contaminated body fluids, that it couldn't be transmitted by air, and it couldn't be transmitted by someone who is asymptomatic. If Americans had known more about this disease, there would not been as much runaway fear.
I think we're scared because it's scary. I mean, people aren't wrong to be scared. Ebola is a fatal disease. It was a disease we had never had in the United States before, and people weren't wrong to be scared of it.
When Craig Spencer was first diagnosed in New York City, it really came and hit home, not only because I live in New York, but I was about 8.5 months pregnant at the time. And I think probably a little bit more conscious and nervous about exposure to germs and disease than I normally would have been, but rode the subway like any other New Yorker.
We had just 1 case, but people were stopping their trips to Dallas, conventions were being canceled, schools were threatened to be closed. This was an unbelievable amount of fear that really I think we couldn't have predicted.
I will never forget the day that I arrived at Newark International Airport in New Jersey. And I remember my mother had actually sent me an email a couple of days before saying, "Are you afraid? There's a lot of fear right now in America about Ebola. Are you afraid to come back?"
And that's when what I call the epidemic of fear. We didn't have an epidemic of Ebola, we had an epidemic of fear in the United States.
Americans' fears escalated swiftly. Their trust and confidence dropped as major mistakes occurred and as the limits of knowledge became obvious and as official guidelines shifted.
On one hand, we had authorities saying, here's what we know about Ebola. It's not airborne. You're only at risk if you're exposed by direct contact to a person who is symptomatic and sick. And on the other hand, We were putting well, healthy healthcare workers in quarantine, telling them, you need to stay inside your house or we're going to arrest you. Or I think society picks up on those discongruent messages and says, one of you's not telling the truth.
The premise that the healthcare experts were going on when this occurred, when Ebola struck the United States, is that any hospital following their normal protocols for sanitary PPE use could handle an Ebola case without infecting a healthcare worker.
And in one conversation with Dr. Frieden, I said, so you're telling me that if I've been to Liberia and I get a fever, you want me to go to Watauga County Hospital and tell them I might have Ebola? And he said, yes, they'll be able to handle it. And I said, doctor, I don't think this is going to work out good for you.
We erred in saying that any hospital could care for a patient with Ebola. We made that error based on the best available evidence that we had at the time.
Although there had been a lot of guidance that had been pushed out by CDC about how to limit the spread of the infection, putting that guidance into real life operations was more complicated. It was a disease that no one had really understood, and even how it was transmitted was not well understood. And so that was the big surprise to all of us, and that was the first lesson learned, that we just did not have our arms around transmission early on.
We initially used the guidelines from the CDC, which were a certain level of personal protective equipment, and then that evolved every day. There was an escalation in the personal protective equipment, eventually ending up with the guidelines that we have for what is called high-level PPE now.
And I think what I'm told by healthcare professionals that we fail to understand and appreciate in our belief in our system is the copious amount, because you're doing IV fluids and some of the other treatments that we do in first world medicine, the copious amounts of contaminated fluids that people would be dealing with.
To be blunt, we were in a tough spot. We were still reliant on Texas Presbyterian to care for the people with Ebola. They had clearly made big mistakes early on in the care of Mr. Duncan. They had sent him home when he said he was from Liberia and had a fever of 103. If they hadn't done that, he wouldn't have been nearly as sick and nearly as infectious when he came back the second time. And the second time when he came back and they were worried about Ebola, the infection control that they did was very non-systematic. They didn't follow the CDC recommendations.
The protocols work. We have decades of experience caring for patients with Ebola, but we know that even a single lapse or breach, inadvertent, can result in infection.
So Mr. Duncan at that point was terribly ill. He was having 2.5 gallons a day of diarrhea. And that amount of diarrhea with highly infectious particles is most likely what led to the 2 nurses becoming infected.
It's hard for many here to imagine. A young woman following every rule risked her life to try and save another. Nina Pham is 26 and was part of the team that treated Thomas Eric Duncan. She sought treatment early.
Well, it's hard for me to talk about this. Imagine having to care for your own colleague. It was pretty bad. And everyone cried all day. You can see that this still causes a lot of reaction for me.
I was at the hospital when they told Nina, I could hear her, and I could hear her parents. They were in the next room when they told them. When Amber flew, despite the fact that she was beginning to show symptoms, I was disappointed in that, and that was something that came across to the public.
We should definitely not have let the second nurse fly the second time. That's because there had already been then Nina Pham, the first nurse, diagnosed, and with that, we realized that all healthcare workers needed to be considered high risk and should not have been allowed to fly. So that was a definite mistake.
CDC had the lead responsibility for communicating with the American people, and it erred early in this phase by being overconfident in our abilities to manage it. There needed to be more nuance, more realism in the descriptions of what we know and what we don't know. They were a little slow at getting to Dallas in strength. They became a magnet for people's frustrations and fears, and they had to struggle against that.
The absence of a strong, unified public health system in America was a major liability and a major cause of tension and confusion.
I think the big irony is that we have some of the most sophisticated hospitals in the world, of course, here in the United States, but we don't necessarily have the best public health system. And by that I mean a system that is extremely well networked, where you have effective systems already in place to train nurses and doctors, for example, on how you manage a suspected Ebola case. It's a very fragmented system.
CDC, by definition, has to assist from the rear. It has to help state and localities respond to these crises. But in the midst of a crisis, people want to see federal authorities jump in and do things really, really rapidly. And so helping from the rear is sometimes not so great.
The challenge was this: each governor had to look out for his or her own state and protect his or own people. That is their job. Well, I was the Ebola response coordinator. People called me the Ebola czar, but I wasn't very czar-like in my powers. But we live in a system of divided and separated powers in the United States. Governors don't answer to the president. They certainly don't answer to the Ebola czar.
I think within Texas, there were some challenges in communication. The public health people understood full well that in the United States, health is a state affair, and it was up to them to do the response with us in a supporting role. The state of Texas and the local area had some friction between them, and early on, before the first press conference, when Mr. Duncan was diagnosed, I spoke with the health officials and the political leaders in the jurisdiction, and I made abundantly clear, we are not in charge, you're in charge. And that's the way it works in this country. Health policy is set at a state level. And while most states followed the CDC recommendations, some didn't. And some didn't because of political posturing, or because of lack of understanding, or because they had so few individuals that affected, they thought it was just made more sense to go their own way.
The media storm, compounded by the U.S. electoral season, profoundly fueled panic and fear.
This is difficult for me to say, but I think this was not journalism's best period. I think a lot of the coverage out of the region, out of Senegal, out of Sierra Leone, Guinea, and Liberia was heroic. I thought the coverage here in the U.S. was appalling. It was so hysterical. It was so wildly spun up. After a while, I stopped turning on CNN and Fox News because I would get so angry. A lot of it is, I think, based in fear, and that's completely rational, and you can easily understand that. But as reporters, we're supposed to sort of parse through that, and I don't think a lot of that was being done.
We didn't see the news media act in the best interest of the country. We saw them act in the best interest of ratings and their own bottom line.
And I remember one call that I had with Kent about 10 days after he got back in the States. I called into Emory and talked to him, and I said, Kent, I got an aggregated media report this week, and your life's never going to be the same. He said, oh, I know, long-term health effects and everything. I said, no. I said, there were 1.7 billion unique visitors to articles about you. He said, billion? I said, billion.
One of my friends had texted me while I was still in Liberia, and he had said that he was getting phone calls from media, and he wanted to know how I wanted him to respond, or if I wanted him to respond. And I said, I responded to him, I'm not sure I understand. Media is calling you? And his response kind of demonstrated the humor in his mind of, yes, some media are calling to find out about you.
I mean, I had several national news corporations come to my front door. Of course, I wasn't there. I'm not sure what they were expecting to find. My husband politely told them I was at work, as I was for weeks.
Yeah, there was one partisan media group, Breitbart. That group filed a CPS, which is a Child Protective Service complaint against me for going home to sleep in the same house with my family. And then they had protesters at my daughter's school, and they sent emails out to various parents.
I think when I go back to the different events, first we had Ken Brantley and the other people being flown back from West Africa, and that became a massive media story with helicopters overhead and dozens of media cameras, front page of the papers, Donald Trump saying we shouldn't have let him back in, and a lot of intense attention to that episode. And frankly, that's when I began receiving quite a few death threats.
I keep the cable quad on in my office all the time. And, you know, there would be polling like, are you more afraid of Ebola or ISIS, right? And you'd have Donald Trump tweeting out. We actually did an analysis. It was that Donald Trump tweet that kind of led to this level of reaction.
The 2014 electoral season stoked the media frenzy. Keep in mind, all members of the House, a third of the Senate, many powerful governors were up for re-election, and they just dove into the deep end. As we're seeing today in 2016, the political climate in the United States was turning really ugly. There was anti-establishment anger and frustration. There was distrust of public authorities, and all of the efforts to try to communicate with the public were running up against that as well. And that was compounded by our electoral season.
As fear and pressure intensified in October, President Obama announced that returning travelers from Ebola countries would enter the United States through 5 airports, where they'd be subject to enhanced screening and assigned to one of 3 categories of risk. Only those at the very highest risk would be confined to home. In the same period, the U.S. military ordered that soldiers deployed to West Africa would undergo a 21-day mandatory quarantine. Ultimately, the overwhelming majority of travelers, over 35,000, entered the lowest risk category. They actively self-monitored and were able to live normally. 500 were of moderate risk, and they were monitored more closely. In retrospect, the system worked very well. Not a single new case of Ebola was imported into the United States. However, in October of 2014, when the system was first introduced, it didn't bring a halt to clashes between the federal government and state authorities. Quite the contrary.
New York's JFK became the first U.S. airport to introduce screening measures for passengers from Liberia, Sierra Leone, and Guinea. Helene, tell us a little bit about this process.
Well, it's I came into Dulles, and I come in to meet the press, and then I go on the show, and we're talking about Ebola, and it was, you know, the aftermath of Thomas Eric Duncan, and after the show, my boss calls me, and they're like, "What are you doing? What are you doing on TV?" And I was like, "I was on Meet the Press." And they're like, "Okay, we'll get back to you tonight. Just go home and stay there."
But the way we were going to make the American people safe from Ebola was to get people to go to West Africa and fight the disease there. And the only way you were going to get people to go to West Africa and fight the disease was tell them that they could come home after they had done that service, right? And so that meant you had to persuade governors that in fact they had to let people come back into their states, and that far from making their populations less safe, was ultimately going to make their populations more safe. That's a hard sell. It's complicated. People understand the fear of someone coming back to their state with Ebola, but the benefit of sending those people is a little more abstract, a little less concrete. And so getting that across, I think, was the biggest challenge we faced in dealing with this domestically.
What we ultimately did was establish, for the first time ever, an active monitoring system so that there was a closed loop, essentially. When someone traveled and came back, we would monitor them. And if there had been a travel ban, we wouldn't have been able to do that because people would have evaded the way of traveling through official channels.
And I came back to this country right in the aftermath of the Thomas Eric Duncan case, and just got hit with this torrent of quarantine, and like this, it was this political firestorm, and and at first I was pretty surprised that things what I thought had been bad to begin with here before I went home had gotten even worse.
Meanwhile, a nurse who lives in Fort Kent, Maine, is upset about being quarantined at a hospital in Newark, New Jersey.
Selflessly giving health care to dying people in Ebola. And this grandstanding Governor Chris Christie sticks her in this completely medically unnecessary isolation chamber.
And the fact is that we're doing exactly the right thing. 6 other states have now agreed with us. The Joint Chiefs of Staff now.
Obviously, it started with just being questioned over and over again at the airport. There was a lot of chaos, not a lot of coordination, didn't seem like a lot of leadership. And quickly I found myself in the tent in New Jersey with Governor Christie, sort of explaining to the population that he was going to protect them and he was going to go above and beyond the CDC protocols to protect the people of New Jersey.
My conclusion that we needed to do this to protect the public health of the people of New Jersey. Governor Cuomo agreed, and now Mayor Emanuel agrees, and I think the CDC eventually will come around to our point of view on this.
What happened in the fall of 2014 was political. It is absolutely clear to us in the analysis we did that this was grandstanding of the highest order, a bipartisan grandstanding. Little did it matter that the way to protect the public was not by using quarantines, which were basically excessive, scientifically unjustified, and constitutionally dubious.
I was scared about what he was going to do to me, about how long he was going to leave me in that tent. And that fear led me to write an op-ed for the Dallas Morning News.
Well, an excess of caution also has to be balanced against people's constitutional rights. You're supposed to use the least restrictive measures in order to protect people against infectious disease outbreaks, not the sort of neutron bomb of public policy in the use of quarantine.
I was in the tent for about 80 hours, a little over 3 days. I was finally allowed to meet with my lawyers through a plastic window of the tent on Sunday evening and released on Monday afternoon.
About 40 quarantines that we could sort of detect through sort of scanning media reports and other reports that happened across the country, about 230 unofficial quarantines. But again, there is no record. You can't go to the state public health departments and ask them, how many people do you quarantine? What are your policies on the books? Because we asked those questions and we were summarily ignored by most of the states across the country.
Ultimately, leadership was essential, from the community level all the way up to the White House.
Most people just wanted to do the right thing. There was a strong sense of camaraderie, a mission. So we were just trying to problem solve and come up with creative ways to make sure that we wanted him to get the best care he could possibly get. We weren't willing to just put him aside and watch him. We wanted him to really get the best medical care he could, and that was our number one priority.
I was concerned about the hospital and the people at the hospital. If you go forward to the night that Nina was diagnosed, I was about to go to sleep, and David Lakey called me on the phone and said she tested positive. I was not expecting a positive test. Our mayor, Mike Rawlings, was asleep. I woke up Mike, told him what had happened. He said, "What are you doing?" And I said, "Well, I'm putting my pants on, I'm going to the hospital." When Amber got sick, it became apparent that the people in the hot zone were actually the first, the medical providers. And I thought it was important for the leadership structure to be there in the building. The building, it was like a tomb almost. I mean, no one was there, no patients were going in. And part of the leadership of that was just telling people they were doing a good job, telling people that you were proud of them.
We were on the edge of a breaking point. We had an expectation that these white knights were going to fly in from the CDC immediately and take care of everything, and that's really not the way it happens. We're responsible for taking care of our own patients, and we had to figure it all out ourselves, and I think every hospital needs to realize that they're going to have to figure it out themselves.
There were several of us that reached out to health departments throughout this region, and in fact across the state of North Carolina, and we would go out, if a health department wanted to, or doctor's offices or a hospital or medical systems wanted to organize a meeting, we would go out and talk with them in great detail about what Ebola was, how it was spread, how it was controlled, and what kind of safety measures they needed. We would circulate the CDC handouts and try to educate medical personnel. And we found that by doing that, by giving people knowledge, it tamped down their anxiety.
In October of 2014, I was invited to the White House for some meetings, but also for a press conference that the president was holding. And they invited me to introduce the president at this press conference. He applauded healthcare workers who had joined the fight against Ebola. And he called on the public to look to these healthcare workers as heroes, as someone to be applauded, not to be feared or stigmatized. And I think the reason they asked me to introduce the president was because they felt like I was a visual representation of the message they were trying to push that day. But that message was critically important to me in October and November, when the hysteria was at its worst and the need for people to respond out of compassion, to relinquish their own right to safety for the well-being of their neighbors, for the well-being of humanity. That was a pivotal time.
For me, it was the fact that the president very quickly identified this as a national security priority, and he himself took it very seriously. He brought in DOD, State Department, as well as our medical health professionals. He insisted on a very high level of accountability and planning in response to this. And without that kind of top-down leadership, we never would have been able to mobilize the response we ultimately got to, which I think ultimately helped contain the disease in West Africa.
Well, I think what President Obama did really effectively was speak very candidly with the American people and tell them that there were risks, there were dangers, but he had a plan to deal with it. And I think that kind of candid conversation was very effective. I think he also did some things symbolically to try to reassure people, giving a big hug to Nina Pham. She came to the White House, the president invited her into the Oval Office, hugged her. That picture went around the world, and it conveyed a message of not stigmatizing healthcare workers, but recognizing them, recognizing their heroism, and that we are comfortable with once someone is treated and cured, they're no longer infectious. That kind of communication. And the president also held events with healthcare workers, a couple of events in the East Room of the White House where he welcomed healthcare workers home, where he shook hands with people who were just back from West Africa to show that we saw no threat to that. You know, that kind of communication is very powerful from the White House. I think it was a big part of our response.
And I thought that this would be a good opportunity, as we got her better and she was being discharged, to completely dispel from the doubt of the public that this was some sort of a pariah now because she's had Ebola.
I have no idea what our society needs from a public health standpoint to engage in whatever future pandemics occur. I'm not a public health expert, but the lessons that I see very clearly from the experience of this Ebola outbreak that will be applicable to future situations are the way we respond as a community and as a society. Whether we choose to be motivated by fear, out of a sense of self-preservation and xenophobia, or whether we choose, in spite of our fear, to have compassion on people in need, to take action, to do good, to do what is right, not only for ourselves, but for us as a global community that's very interconnected.
We now realize that if we're going to be better prepared in the future, that we need to get moving really rapidly and get ahead of these crises, and that the White House needs to lead. We know that we have to go into these crises with our eyes wide open. They bring out both the best and the worst in us. And we know we need to be honest with ourselves. We're going to often be ill-prepared and vulnerable. Zika is now upon us, the threat that we may see an epidemic on our soil in Puerto Rico and in Latin America of babies born with serious brain damage. But we're struggling. We're struggling now. We don't have adequate funds. available. The capacities are not in place. We don't have vaccines and diagnostic tools, and we face a polarized politics at home. But I remain fundamentally optimistic. We have courageous and expert leaders here at home. We have exceptional capacities that are essential for the response at home and abroad. Today, we can look back and see that Ebola and Zika have taught us that we need to do better, that too much is at stake.
Here's a lesson learned for you. If you're gonna appear on nationwide TV, moving a person who may or may not have Ebola to an undisclosed location, go ahead and tell your wife ahead of time, particularly if she's gonna find out about it in front of a bunch of other moms who have children in your daughter's class at a school fundraising function. I got home about 10 o'clock that night. I parked out in front of the house and she was on me like JJ Watt, out the door, on me. The neighbors all came outside and were yelling at me. It was comical, but not funny at the time.